Celebrating Women's Day on every 8th of March each year is now more of meeting a traditional demand than actually addressing critical issues that affect women, like maternal mortality that led to loss of lives. Today, 16 women die every day in Uganda while giving birth, a rate that is more worrying with little done to save mothers. Nasur Sebi is a 45-year-old father of 5 who lost his wife during pregnancy. Nasur's wife died 8 years ago after the baby died in the stomach, and he's still mourning the circumstances under which his wife died.
I told the doctor what I just need for him just to save my wife. And the doctor just delayed. The operation took place at around midnight.
Just like Nasur decries, several other families have lost their mothers at times due to negligence of some medical attendants or mothers themselves. Available data indicate that maternal mortality accounts for 80% in Uganda, with and Nasur's wife adds to that figure this year.
She has lost a lot of blood, and what they didn't do by that time, if they could have been giving us some more blood, that one could happen.
Half of every 340,000 women who die in Uganda due to overbleeding, and how to prevent it remain in the hands of health experts.
So what we have to do is to work as a team to try and solve the problem. How are we going to solve it? Is by, first of all, stopping the bleeding. How are we stopping the bleeding? It will depend on the cause.
Dr. Bali Kudembe blames it on some expectant mothers who seek medical attention late, yet some have ruptured uteruses, a stillbirth, unobstructed labor, incomplete abortion, and a bleeding cancer of the cervix, and thus resulting into death.
So infections, UTIs, are the common causes of death.
The situation is, however, getting out of hands in rural, where maternity mortality accounts for 90%, mainly due to poverty, illiteracy, high rates of childbirth, and pregnant women being subjected to excessive work. Excessive work strains, weakens women, and exhausts them, which in turn cause complications which lead to their death during delivery. This in addition to lack of health facilities, while in some areas these facilities are far, and considering the poor transport means, women are left with either visiting traditional doctors or self-delivery, thus leading to death.
Majority don't even die there. Majority even die at our health facilities, because most of the time they reach late. Then at the facility also sometimes there's a delay.
Worse still, even major hospitals lack basic delivery kits like scissors, cord clamps, and disinfectant. 2010 Ministry of Health report revealed that some birth attendants ignore mothers who visit health facilities during delivery. Others simply harass them, while some are not doing or not knowing what to do.
In our policy for village health teams, we incorporated traditional birth attendants to encourage referral, and we encourage mobilization and referral.
Unfortunately, not so much is being done, despite different stakeholders organizing workshops in hotels to discuss maternal mortality, whose input remain on paper and for accountability purposes, yet is preventable.
Infections, especially postpartum infections, what we call puerperal sepsis, unsafe abortions, obstructed labor, and even hypertensive diseases, and other malarias, other indirect causes, malaria, TB. Those are all, it's within our means to prevent this.
The failure to access antenatal services has also contributed to the increasing maternal deaths, because women who attend antenatal are advised to keep away from heavy workload, since most men have as well failed to support their pregnant wives. And as Uganda joins the rest of the world to mark the World Women's Day, maternal deaths remain a big challenge to Ugandan women, thus the need to keep the ration down.
Nasur Sebi is one of the men who have lost their dearly wives before, during, or after giving birth in Uganda, which means maternal mortality is still a big challenge within the country. Zam Zam Siraji, WBS News, Kitintali.